This meeting is being recorded.
Hi, my name is Vernon. I'm an experience advisor here at Riverview in the Office of Patient Experience. And today I want to talk to you about what our team, Patient Experience, does and how we can partner with you to create the optimal patient experience. One thing you might not know about Patient Experience, we are located on the 6th floor around the corner from the pharmacy and nursing administration. Our department is comprised of different team members with different roles. Our first team member is our coordinator, Taniqua Bailey. She oversees the day-to-day operations of Patient Experience and keeps us all on task. She's the one who probably will answer the phone if you call our department. Then we also have ambassadors. Our ambassadors round on each of the units. They round on all of our patients and try to proactively handle any concerns, complaints, issues. We'll talk about more of that later. We also have an advisor, that's me. I manage complaints and grievances for the hospital. I assist the ambassadors on their day-to-day rounding and proactive interventions. We also have a manager, that's Kimberly Gittens. She is part of our leadership team. She also works with hospital leadership. She deals with high-level concerns. She works with data. She reports to the corporate, to the network. Our daily tasks. As I said, we all round. We try to round on each patient and have each patient have 1 to 3 touch points. That is actually determined by the length of stay. Obviously, if a patient's here for 1 day, we're not going to see them 3 times. If they're here for longer, we try to see them for at least 3 different times. We try to handle any concerns, any issues in real time to make sure that the patient has an excellent patient experience. We also oversee intensives. These are run by the advisors, that's me. They're in-depth training for the team. We work on each unit to try to raise the HCAHPS scores. The HCAHPS, if you don't know, are surveys that are distributed by CMS, by Medicare. They rate and rank different hospitals based on patient experience, the patient's perception of the care that they received when they were here. And they look at things like nurse communication, responsiveness of the team, cleanliness of the room, quietness at night, doctor communication, coordination of care with discharge. We try to look at those surveys and try to raise the scores. We get paid, all hospitals get paid from CMS based on reaching certain goals and benchmarks. And as an advisor, I try to coach the team, work with the unit leadership and with hospital leadership on picking the units that we work on to help raise those HCAHPS scores. This year as well, we're going to have a hospital-wide training from the network on patient experience, on how to create great patient experience, communicate well with our patients and our families, and handle different issues and concerns. That's going to be coming in the next quarter and this year. And it's being done throughout the network at all the different hospitals. We also manage complaints and grievances. When patients are here and families are here, they may have concerns and issues. We try to handle them in real time. If they leave and respond with different concerns that they had while they were here, we try to handle them. They are grievances. We follow up. We try to create resolutions. We act as liaisons with hospital administration and leadership and the different care teams and the patients and families. We try to investigate and make sure that if we can learn from an experience, we do, that we create a better care for patients and families for all future concerns when they come here. We try to proactively work with our patients and families to make sure that these complaints and grievances are handled. We also have a PFAC committee, which is our Patient Family Advisory Committee. These are members of the community and past patients and family members who are interested in helping the hospital with different committees and concerns. They advise us on what the community feels that we need to be doing. We oversee that patient family advisory committee and coordinate with them. We also oversee the volunteers. These are the interns and volunteers. We recruit, we manage, and we make sure all of our volunteers and interns are onboarded appropriately. We also manage the front desk. The guest ambassadors are at the front desk to screen our visitors, to greet them, to make sure that they appropriately mask when they come in, and to make sure that when patients' families visit and friends visit, that they have an optimal experience as well. That leads to visitation issues. Because of COVID and throughout the past 3 years, visitation has changed off and on. We oversee those changes in policy, we implement them, and we work with the floors and the units to make sure that the visitation policies are being abided by with our visitors. If you have any issues with visitation, we encourage you, we empower you to try to deal with it. If you see too many visitors in a room, please feel free to speak to those visitors and make sure that it's just the number of visitors that are allowed in the room. If you see someone not wearing a mask, please feel empowered to speak to people and ask them to wear their masks. If you have any concerns and you can't seem to handle it, you can always please reach out to the Office of Patient Experience. We're here to partner with you and together make sure that visitation is abided by. If we all fail, we can always call security to help us. When dealing with complaints, we always use the CARE model. The CARE model stands for connecting, acknowledging, responding, and expressing appreciation. If a family member or a patient is here and has a concern or an issue, we want to talk to them, we want to connect with them, listen to what they're saying, actively listen, identify what the issue is. That always can be done if you just restate what a patient is saying or a family member is saying. For an example, if they have a concern about the food, they didn't get the food they needed. You actively listen and then you can just restate. I hear that what you're saying is you were brought up the wrong food, that your food was cold. And that makes the patient understand that you heard them and that you're connecting with them. You acknowledge their concern. You can say, I understand this is very difficult. You're not feeling well. You really want the correct food. You're hungry. Then you want to respond. You want to tell the patient what you're going to do about the concern, how you're going to deal with it. You want to tell them, I'm going to call down to the kitchen. I'm going to make sure you get the correct food. We're going to handle this right now. If it doesn't happen immediately, whatever the concern is, always round back, let them know what you're doing. Let the patient know how you're handling it. You can always go back and say, I haven't gotten through yet, but I am still working on this. I will get back to you. And then always express appreciation. Thank the patient, thank the family member for bringing their concerns to you. All concerns are important. All feedback is important. It helps us improve. It helps the experience for that patient to be a better experience, but it also helps future patients and future families that their experience will be better. We learn from everything. We always want patients and families to feel comfortable that they spoke with us and to feel like we are there partnering with them to help them. So your responsibilities, we want you to feel empowered to communicate to us immediately if you have a concern or an issue with a patient or a family member that you're unable to handle. Our extension is 2484. Let us help. We're always here to partner with you. Always work to get a resolution. If it's something that you can handle in real time at the moment and you can resolve, please do that. Please feel empowered to do that. Otherwise, always feel like you can escalate. You can escalate to patient experience, but you also should be able to escalate it to your supervisor, your manager, to the house supervisor. please feel free to know that when you need to bump up an issue or concern to get a resolution for a patient or a family member. And always, as I said, try to provide timely feedback. Tell the patient or family member what you're working on. Let them know when you're going to try to get back to them. Always keep them updated. This takes the fear away. This makes the patient or family member feel safe. They know that they are partnering with you, that we are together, a team, and that we are trying to make sure that they have the best patient and family experience while they're here. Some additional services we have, most of us notaries in this department. We are here, we can notarize healthcare proxies, advance directives. We can also notarize things for team members that might involve your work. So if you're doing anything for your nursing certification and you need a notary, we are here to help you as well. We are not allowed to notarize anything that's financial. So no last wills and testament, no financial powers of attorney. But we also can hand out advance directives and healthcare proxies if the patients need those. Always feel free to call our office. We are here to help with that. We also have an amenities cart, which has items that patients might need while they're here. Things such as deodorant, cards, combs, denture cream, crossword puzzles. So if any of those items are needed, please call extension 2484. We can bring that card around. If there's something a patient's asking for that you don't know how to get, please call us. We can partner with you. If it's something we can figure out or we can get in the gift shop, we will do it for you. We were here actually to make this the best patient experience for our patients and family members. So I hope I explained the department well. If you need us, we're here together. We're all part of the Office of Patient Experience. We're all trying to help. So I look forward to working with all of you this year and that you get to know our team. Thank you.